Alright, so I have an order here for Frank Miller, date of birth 7/4/1958. He is allergic to penicillin and atorvastatin, and I will be placing an IV that will be capped. So for that purpose, I'm going to place a 22 gauge 1-inch needle. I'm going to have Tegaderm, which he is not allergic, and I'm going to gather my supplies. I need 2 flushes, neither of which are expired. I need a CHG for cleaning. I need J-tube or extension tubing. I need gauze, tape, and a tourniquet. All right. And now I'm going to wash my hands and go into the room. And I will have brought my supplies with me. Knock, knock, knock. Hi Frank, I'm Julie, I'm your student nurse. I'm here to place an IV. Is that okay? And he says it is. Can you please verify your date of birth, 7/4/1958, and your name, Frank Miller, and I have put that to the MAR, and they are the same. Frank, do you have any allergies? And he tells me penicillin and atorvastatin. And do you have an arm preference? And he tells me the left arm because he already has an IV in his right. And now I'm going to get my gloves, which I already have in the room. And then we're going to put that IV in. So I'm going to come over here to his left arm. Looks like somebody was already here, so I'm going to remove the old tourniquet. And I'm going to walk Frank through the procedure while I get myself set up here. So Frank, I'm going to be placing an IV. The IV is just, it's a needle to get it in the vein, and then I'll be removing the needle, and it'll just be a little plastic catheter that we use to give you medicine. Is that okay? And he says it is. I double checked my order. I'm going to assess the patient's vein, and I see a good one right here. I'm going to place my tourniquet, and then I'll perform my CHG. And I would have laid chucks down for cleanliness. Put my gloves on. Alright, and I'm going to clean. I'm going to clean the area for 30 seconds. Alright, while that's drying, I'm going to set up my supplies. I'm going to open up my Tegaderm and being careful. I'm just going to lay it here for the moment. And I have my tape. Get that started. And then I have my J-tube, and I have my saline, which I would have already gotten the air bubbles out. I'm going to prime it. Not touching the tip. I'm going to open my J-tube, exposing the ends. I'm going to prep my line. Not touching the tip to anything. And it is primed. I'm going to pull back the paper, just exposing very little. And I'm going to loosen my cap. Just like so. Get that ready. Not touching any area that I've cleaned. Then I'm also going to get my needle out of the packaging and get the cap loose on that. So that's ready. Now I'm going to prep my Tegaderm, making sure not to touch anything but the outer edges. Like so. And now I'm going to apply my tourniquet, making sure not to leave it on for more than 2 minutes. Alright, I'm not going to touch the field where I've cleaned. I have my needle bevel up. It's a 22 gauge. I'm going to go in at 10 to 20 degrees. I'm going to go in, watch for a flash. I'm going to come down flush, 1/8 of an inch more, get a good hold of my cannula. I'm going to advance it, not letting go. I'm going to safety my needle, apply pressure. I'm going to get the extension tubing out. Take the lid off, apply that, and make it a closed system, not touching anything to anything else. Release my tourniquet. I'm going to clean my area. And I'm going to apply my Tegaderm. To just the cannula. And tidy up a little bit more here. Now that it's secure, I'm just going to make sure that we're fully attached. I'm going to look for a flash. I see one. I'm going to flush with a pulsating motion. I'm going to flush 3 to 5 milliliters. I am going to clamp. I am going to take this off. I now have a closed system. And now I will take this off of here. I'm going to date and initial my IV dressing and label that here, anywhere on the Tegaderm. I'm going to take my prepared tape and I'm going to tape my cannula down. I'm going to put my needle into the needle box. I'm going to gather my garbage, put anything that contains blood into the biohazard bin. I'm going to remove my tourniquet. Frank, how did that go? Any issues? He tells me no. And now I'm going to document. I'm going to document that I put Frank's IV, 22 gauge, 1 inch needle into his left distal forearm, 1 attempt. He handled it well, and put my credentials. I'm going to lower his bed down, and I'm going to give him his call light, and that's it.